Good morning, everyone. This is Raj, Doctor of Physical Therapy. Welcome to Senior Citizen Wellbeing Facebook and YouTube Live. And I'm with Dr. Ryan Perron, physical therapist. So we are going to talk about cancer. Today's topic is cancer and how physical therapy can help. What's the role of physical therapy in cancer? So, Ryan and I were talking briefly before this going live, and we talked about how important physical therapist role is in early detection. That's the starting point. So, when a patient comes to a physical therapist, they are doing in a way they are working with the patient closely than a doctor, because when you see a doctor, you're there for 10-15 minutes, and the doctor is not really spending too much time talking about everything, or they may not be looking at your body parts unless you tell them there's a problem. So when you come to physical therapist, on the other hand, you spend 30 to 45 minutes or an hour, and you talk to physical therapist more, or physical therapy assistant more, about your problems, your emotional if you share more things with a physical therapy clinic, is either assistants or a therapist, and they know you more in general. That way the physical therapist can connect with you more and ask you more questions about your health problems. And also, most people, I mean, if you're going to a physical therapist, you shouldn't really go in jeans and tight shirts, and you usually you wear loose clothes because you're exercising there. You may be stretching, you may be doing different, based on the situation. You may have to remove your shirt or to for examination, or pants, based on your situation. So you wear loose clothes, and the therapist can get to you know detect if there is any problems on your body, like a darker skin larger than pencil head size. So they can notify you and call the doctor up and say, hey, I've noticed something that's suspicious on the body, so that needs closer supervision, at least evaluation, so that needs to be that can be early detected. So that's something we briefly talked about. Ryan, do you want to say anything about the early detection? Do you have any thoughts on that?
I agree. I find that one of the things that the therapists do, sometimes we'll see, a patient twice a week or, three times a week. And then we have a better chance of observing that and watching that. And, for example, I mean, the diagnosis the person comes in is the shoulder pain and what. And so a lot of times we'll have them remove their shirt and look at the back and see the scapular pattern, the shoulder blade, how it moves and stuff. And maybe sometimes you see, oh, there's a bit of a skin abnormality on your back there or something. Do you know about that or whatnot? And so we have a better chance of catching those things than a doctor would, because you think about it, 15, 20 minutes maybe with a doctor is not enough really time to share everything and whatnot. And you know how many times you go into a doctor's office and you leave the doctor thinking, oh shoot, I forgot to talk to him or her about this and that. And so sometimes it's always a rush, but physical therapists have that opportunity to really um, catch those things.
Yeah, great. So that's the early detection part of it, where we are. helping the patient or the doctor find the problem sooner. So that's a key role that physical therapists can play in cancer early detection. Um, or yeah, preventative care. So preventative care, a physical therapist is well educated. So we went to school for five plus years altogether. We studied all aspects of human physiology, human anatomy, and we have knowledge that a some people ask, like, physical therapists, they compare with massage therapists or chiropractors are well educated as well, but massage therapists are, education wise, it's not as intense as a physical therapist or chiropractor. So the depth of knowledge on physiology, anatomy is huge for physical therapists. So we can talk to you more about nutrition, anatomy, physiology, aspects of human body, and even emotional aspects that we deal with, the quality of life cycle. We are, in a way, we are holistic, treating a person in a holistic manner. So we talk about so many different aspects of each person's health and wellness. So in that, nutrition is also part of it. So we encourage people to, excuse me, to eat healthy, avoid any bad habits if they have. So that's a kind of a preventative aspect is of physical therapist in cancer prevention. So anything do you want to mention about preventative aspect, Ryan?
Yeah, I think, sometimes with cancer, that's sometimes some of us is just going to get it no matter what we do. But I think, if we can control, like I can control what I can control, maybe I can help reduce the risk of it, or, if delay the onset of it or whatnot, or I can just not care about it and then find that maybe the things I should be abstaining from that are increasing risk of cancers will increase that risk sooner than later. So I would rather try to just, look at what I can do and focus on what I can do. And then by doing that, though, what helps is it helps to prepare that if you do get that, you've had nothing but all this past history of working on what you can control, and that helps better prepare for those situations that we don't have control come up, whether that be cancer or anything else. So,
Yeah. So as you were saying, the things that we control, I'm recalling, there are modifiable and non-modifiable factors,
yeah.
right? So modifiable factors are some things that we focus on, we can control, like, smoking prevents lung cancer. If you stop smoking, you decrease the chance of lung
Hmm.
cancer in a huge, percentage wise. But and also exposure to sun, especially between 10 a.m. to 4 p.m., avoiding the sun exposure too much. If you're in and out, that's fine. But if you're some people that, especially people that go to beach frequently, they want to
Hmm.
wear short clothes, and they just want to be in the sun all day, which is kind of a scary thing because skin burns increase the risk of cancer much more than skin burns. People may not know it, and they just expose more frequently, and they get skin cancers. So that is something if you know, you avoid being exposed in the sun during those times, like 10 to 4 p.m. So such things, I mean, just knowing some simple things like that is going to prevent, that's a modifiable factor. So especially anyone that is scared of cancer should know all these,
Mhm.
understand about how to prevent cancer in the first place. um, and some are non-modifiable, like genetic. When some genetic factors, you can change them.
Yeah.
If your parents or grandparents had cancer, and you may not necessary that you will get it, but the risk of getting it is
Yeah.
high. So that is non-modifiable. You can't change it. So you have to prepare yourself how to deal with it. So that's another aspect. That's modifiable and non-modifiable factors. And another thing is, in my personal experience, I worked with patients with cancer at so many different stages. Some are early, they were diagnosed and starting chemo or radiation. Some are mid stages of cancer treatment. Some are later stages of cancer treatment. And I've seen some patients that are given up, like, or all exhausted all the treatment options, and they're pretty much ready for dying, actively dying because of the cancer. So I've worked with all stages of patients with cancer, and especially if they're in the early stages, the emotional aspect is the key. How to keep them focused on living life and doing what they can do. Energy conservation was, um, especially in the early phases, energy conservation may not be as important because patients are just starting the therapy, chemotherapy. So they may be fine, but as they move in the process, in the stages, energy conservation becomes the utmost important thing. I know, Ryan, you talked about energy conservation. I liked about what you said. So can you tell the audience about energy conservation, please?
Yeah, you bet. I like how you mentioned too, though. I think in preparation for energy conservation is like Raj was saying that the first bit of the chemo treatment, you might not notice any changes in effect, but it will come when just doing some simple things can be very exhausting and taxing. And so it's good to start early to plan out your day. Even if you're doing fine and you think you can do everything, I would still plan it out. And then you just pick the task that you have and which one might be the most important thing to do. And then you just tackle those things first thing, because that's when you'll have most of the energy, is the first part of the day. And then if you're not able to get to everything through the task, just tell yourself that's okay. You don't need to add more to the plate with stress and that. So you just schedule it for the next day and you say, okay, I didn't get this done today, but that's going to be the next most important list to do. And then you put that in for the next day. And so just being aware of energy conservation, because your body is trying to heal, and that does take a lot of energy. And about the third session of chemotherapy usually saps it out of people. And so if you're prepared for that, you're mentally prepared for it and kind of expecting it, it doesn't come as a surprise. And you're able to deal with it a bit better and handle it better.
Yeah, great. And as I mentioned, mental and emotional aspect is also a major, it plays a major role in how well the cancer patient, patients with cancer progress in their rehabilitation. So I I've seen a patient that's really like, I started the patient really early, and I followed through for several months. And how, initially, when that happened, she was, you know uh, um, she felt like there's no life for her. There's no, she's going to die pretty soon, or because they didn't really know exactly, all types of cancers. I mean, some cancers, they can't tell, how long, whether this will work or not. For some type of cancers, they know it works. Sometimes they don't know. Sometimes they know they're going to die pretty soon in the next few months. So based on that stage, what stage you are, I've seen this patient, started really feeling like she can't do anything, in bed all day and night, depressed. Within few weeks after starting treatment, and she started working with the family and friends, and she started feeling better. And I couldn't believe, I started the patient, my assistant started seeing the patient. After several weeks, I went to see reevaluate her, and I couldn't believe, I mean, she was so much better walking with the walker. And I walked her outside the home and came back. I couldn't believe it. I mean, like, she huge change. So you don't really know. You have to, when you first see the patient, you may not see how to progress this patient. But as the days go by, they settle emotionally, they settle, they know what's going on, then they can, so as a physical therapist, I was supporting her stages, different stages of the treatment, cancer treatment. And it's like a hand in hand, like you work with your medical doctor to take care of the cancer, and a physical therapist works with you, supports you emotionally, motivates you to do exercises, and stick to your exercise plan. And physical therapists will progress, they know when to tell you to quit using the walker or start using a cane, or how to progress you to the next
Mhm.
level, how to improve your balance, how to improve your strength. So that's how a physical therapist can support you in situations of patient dealing with cancer. Um, that's my experience working with the patient, cancer patient. Do you have any experiences, Ryan? I'm sure you do, but can you share
Yeah,
some?
of course. Yeah, of course. A lot of it is, the body's going through the recovery phase, and my focus is to help the body through that recovery phase. And when we talk about exercise, I mean, I think in general, there's it's kind of a term a lot of people think, okay, exercise, that's working out really hard, that's sweating it out. I mean, that's exercise, but I'd like to be more specific on that. Like, exercise could be in a way, maybe it's just a person maintaining, maybe it's a person strengthening, maybe it's a person recovering. And so, whatever it is, there's a different intensity level that's appropriate for the situation. And I always tell patients, you're going through cancer, you're going through chemo, your body has a lot on its plate right now. And so we don't want to add to that plate. So let's figure out and do things in a way that helps to get that off the plate. And so exercise or recovery, rehabilitation can be an avenue that can help get things off the plate to help the body to recover and to heal. And so a lot of it is not based on, okay, I have to walk this much every day and I have to do this many repetitions every day. It's not really what it's all about. It's about listening to your body and working together with it. And so it's impressive. Our body is a fighter. It's designed to survive, and it will do what it can do to survive. And it's just a matter of us making that emotional connection with our body and trying to help it and work together with it. And so, going through chemo, it's important to stay active. And we talked about energy conservation. You don't want to use all your energy exercising, and then you don't have anything left to do what you need to do the rest of the day. So, and that's what a physical therapist can help you and guide you through that process.
Exactly. I like the aspect where you said, just getting up and moving and doing whatever you can. Obviously, that improves your blood circulation. We talked
Mhm.
about it before the session. So that improves your blood circulation. As the blood circulation improves, you when you're exercising or when you increase your heart rate, your blood circulation increases, and
Hmm.
that makes you feel better.
Yeah.
So you may not know it. No, yeah. I mean, you might have experienced when you are exercising, your mood is uplifted. You know,
Hmm.
you feel better. You start secreting hormones, endorphins, so they make you feel better. So same principle, even with your cancer situation, you are same. Nothing has changed. There are some bad stuff that needs to be addressed
Hmm.
by your body, and your doctor is helping with medication. So you do your part. You get up and keep moving, and that improves your blood circulation. And Ryan, you mentioned the chemotherapy works better, well, because the chemotherapy is running in your blood. It is going to different parts of your body. So that was the another aspect. You are helping your body heal faster when you exercise. Even with the cancer, you have to do what you have to, like what you can.
Yeah. Another good way to think about it, when you're moving and walking or doing something with your muscles, they call it a skeletal muscle pump. And so every time your muscle contracts and relax to move, that's like having an extra set of hearts to help with the blood flow going through. And when you're getting better blood flow going through, you're getting better recovery. You're in a better state of healing. But we have to be careful too. Doesn't mean that, okay, well, if that's good, then more is better. It's not the case there. So again, it's about learning to listen to your body while you're doing these activities.
Oh, thank you so much, Ryan. And that's the end of today's video live session. And if you're watching from, I mean, please post comments even after the end of this session. Post where you're watching it from, and how you're liking it. Well, what if you have any questions, post them and ask us, like, next topic. Give us suggestions. So based on what medium you're watching in, Facebook or YouTube, like it, share it with your friends if you like the video. So subscribe on YouTube if you're watching on YouTube. Thank you so much, again, for your patience and joining us and listening to us. So we share our personal experiences as a physical therapist in these videos, and try to come up with more topics and interesting conversations. Again, thank you so much. You guys have a good day. Thanks, Ryan.
Thank you.
Bye bye.